I'm Andrew Logan. I'm a senior lecturer in vision sciences at Glasgow Caledonian University, and I'm also the programme leader for our new Master of Optometry with Independent Prescribing programme.
Hi, I'm Rupalava Patel. I'm currently the Associate Dean for Students and Teaching, but I was the academic lead for vision sciences at University of Central Lancashire.
My name is Will Holmes. I am Reader in Optometry Education at the University of Manchester, and we've just had a session really trying to help people understand why the changes in education have happened and how various parts of the optometry education sector are adapting to those changes. What do those education and training requirements say then? What are the big changes that the GOC have mandated? So number one, every optometry qualification has to be at master's level. Second big headline change is the 48 weeks patient-facing experience has got to be integrated. In other words, what we currently call the pre-registration year, that big chunk of clinical experience, has to sit within that 4-year programme. It cannot be after it or outside of it. The three of us kind of represent the three main ways in which clinical placements or the approach to adjusting to what the GOC have asked education to do is going to be formulated, going to be made up. So between the three of us, we think we can give you a picture pretty much of what's happening across the piece.
There are three major changes for our programme. Firstly, GCU is now the sole provider that's responsible for the training of our individual students. Secondly, we are now offering a 5-year integrated master's programme. And thirdly, we are integrating independent prescribing training with our students' undergraduate optometric education. In year 5, that's sort of the replacement for the pre-registration year is probably the easiest way to think of it. We are integrating into that level 5 or 5th year, final year, a 52-week placement, which will include experience in independent prescribing. And we are partnering to deliver this with NHS Education for Scotland, or NES. The funding for the programme is provided by the Scottish Government. The Scottish Government have worked in partnership with NHS Education for Scotland, or NES, in order to support the two universities in Scotland, Glasgow Caledonian University and the University of the Highlands and Islands, in developing our new programmes in optometry. One of the key aspects is that the Scottish Government will provide funding so that students receive a salary whilst they're on their final year placement. And our first cohort will enter those in the academic year 28-29. Now, rather than giving the student one placement in a single practice for the full 52 weeks, we've taken the decision to offer each student 2 separate 6-month blocks. And the motivation for that is to give them different experiences. So they might have a placement in a city centre practice for 6 months, and then they might have a placement in a hospital eye department for 6 months. At least one of those placements will be with an independent prescribing optometrist as the student's supervisor, so that they can build up their IP experience. The new programme will equip students at the point of registration to be optometrists with the independent prescribing specialty. And we view that as a positive step to recognising that optometrists are the first port of call for patients that present with symptoms of diseases of the eye and vision. We want to prepare our graduates to ensure that they're ready to meet the needs of communities across Scotland. The obvious concern here, and I want to be really clear about this, what we're not saying is that at the point of graduation, so year 5 plus 1 day, these students can go out there and manage a complex case of anterior uveitis by themselves. We see the IP training as much more of a journey that will continue after graduation. What we are doing is giving them the theoretical foundations and the initial clinical experience that gets them to the point of being safe to manage a certain number of conditions. But in order for them to be safe at managing more complex and broad spectrum conditions, that will require additional training. We've just enjoyed Freshers Week with our first cohort of students, and their first day of training is tomorrow. We're very excited to begin the new programme, and we've had a really enjoyable week with a great bunch of new students.
What we've done is we've taken the opportunity to revisit the way we do things. So our two core changes really are around team-based and case-based learning, so students learning in groups using clinical cases from year one as the way that they learn the material. You see there's a spiral on the screen there. As you go into second year and third year and fourth year, you may then revisit the same patient, but with increased application. So in the second year, it might not be about what is the macula and the optics of an OCT, but a little bit more about the pathophysiology and the pharmacology of what we might use to treat it, all the way up to the fourth year, where essentially students are managing patients like that. But also a move away from these single discrete assessments of clinical competence, so things like OSCEs, and towards a more continuous approach where students are working in real practice environments and showing us they can be trusted with those particular activities. So I'm not saying this week we're going to assess you on, I don't know, Volk, whatever. What we're doing is we're saying these are the entrustable activities for you for your first, second, third and fourth year. And you've got to show us as an academic team, as a clinical team each year, that you can be trusted with those skills. A big theme though is kind of around creating community on the course. So yes, we're doing things to do with eyes, to do with optometry, but we really want to build a course which is strong community, because a lot of what we're doing in our new course is teams based. So we'll be having second, third and fourth year students forming clinical teams, working together, seeing patients. You can think of it as a little bit like the second year being like the optometric assistant, the third year being a bit more of an advanced optometric assistant, and the fourth year being the person who's taking control of the patient under supervision, of course.
Because we are one of the newer universities starting optometry, the course was designed specifically for what the future or the new way of optometry is. The universities are still the main providers of education. They will graduate the students as an integrated master's. So they are responsible for the whole journey. The college is then working with the university in actually the final part of that placement. The college with universities have agreed that they will provide 44 weeks, 2 blocks of 22 weeks. The college assessors will be going in, doing work-based assessments, marking the students, and if they then fail something, there is chance for them to do resits before they go on to the next block. So effectively, if you're spiraling their learning, there's no point them trailing a fail before they go to something that's more complex. So that's why they decided, let's put it into blocks. It gives the student a chance to make sure they finish the learning in one block before they progress on to the next more complicated blocks as well. Where the pre-reg was average 15 months, now we have to get it done in 44 weeks. So the pressure is now on for those students to get their experience, to get their outcomes finished and completed in a shorter time period as well. There's no numbers, so we're not worried about they need to do 200 and something eye tests or so many contact lenses. It's, are they safe? College will be the first point of contact for employers. College will also support the supervisor training for those who are going clip supervision and assessor training. The student must be paid, and we're not talking about minimal payment. It is going to have to be paid for the kind of work they're doing. They're going to have to allow them a day. The employers have agreed it's going to be 4 days. They will allow them a day of protected study as well. They will deal with the employee matters. So they will have to deal with leave or underperformance, arrange any specialist supervision if they wanted to go and spend time in a local hospital, so they understand the local pathways, then they will have to do that. The university will already provided some experience in the first 2.5 or 3 years. I would say we are providing a modern approach to education for what the future needs. And we are being more proactive, more responsive, rather than being reactive, which we might have done in the past. The technology for teaching, the world has changed drastically. The way technology innovation is going is so fast that I think the new ETR scope and the way the outcomes are mentioned and designed allows that scope to change without going through huge heaps of, oh, we've had to change the curriculum vastly and then you need the GOC to come and reapprove it. There is still scope for us to work within the outcomes and still deliver something that's fit for the future.